If you are thinking of becoming a nurse practitioner versus becoming a physician associate or physician assistant, this episode is for you. We're going to welcome Michelle Tom, who is a nurse practitioner. She became a nurse practitioner about a year ago and currently in fellowship program. And we're going to discuss pros and cons of becoming a nurse practitioner versus becoming a physician assistant. Let's dive in. Hi, thank you for joining us today. Before we dive into today's topic, I have a gift for you. I made a free PDF about the nurse practitioner job interview prep checklist to help you to prepare for job interviews so you can feel confident and get great opportunities to achieve your dream lifestyle. This is actually a part of our new program, New Grad Nurse Practitioner Career Accelerator, which will be launched in June, but I decided to share this amazing resource with you to show my appreciation for supporting my channel. To get this free nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. And we will give you this free PDF download in addition to weekly emails that are full of information to help you successfully complete nurse practitioner program and build amazing nurse practitioner careers. All right, let's dive into today's episode. Michelle, welcome back to our channel. Thank you so much again for making time for this. So today we're gonna talk about pros and cons of becoming a nurse practitioner. And so for your background, for those who don't know Michelle's background, maybe you can explain the background before you becoming a nurse practitioner.
Sure. So I worked as a dietitian for years before deciding I wanted to expand my scope of practice. So I had healthcare background, but then again wanted to expand my knowledge base and what I could provide patients with. So that's how I ended up being a nurse practitioner.
So for me, I was a nurse before going to nurse practitioner program. For me, it seems like very natural to go to a nurse practitioner program versus going to PA schools. But for you, you are in the medical field, but you had an opportunity to go either or nurse practitioner program and then a PA school. Was there any particular reason why you chose nurse practitioner program over PA school?
Yeah, I chose the NP pathway for multiple reasons, and I can't speak to the PA pathway as I haven't experienced it myself, but where I work, there's a lot of both nurse practitioners and PAs that work hand in hand and have very similar positions. But one of the reasons why the NP pathway was appealing to me was because it does offer the opportunity to practice independently. What's important to note is that this is dependent on state practice and licensure laws. So there's currently 27 states that give nurse practitioners full practice authority, and Hawaii is one of them, which is where I live. So I liked that aspect of it. In addition to that, being a dietitian beforehand, there was a fast track into nursing and then into the nurse practitioner route. So once I got my BSN, I was able to work while I was finishing up my nurse practitioner degree. And so that whole pathway was really appealing. And at the end of the day, were big reasons why I chose the NP pathway.
Yeah, that makes sense. So how long did it take to finish? So your nurse practitioner program was what we call GAPN. So there's an accelerated course for those who don't have RN at the time of entering nurse practitioner program. And so it's in total 3 years or 4 years in total?
So in total, with the fast track 1 year in nursing, it was 4 years total. So first year is fast track to nursing, yeah, and then the last 3 are the nurse practitioner portion.
And that's because you are in the DNP track.
Exactly. Yeah.
Okay, so 4 years. And then you mentioned that you were able to work as a nurse, and that was one of the really a big advantage of choosing the NP path.
Yeah, so I was able to get experience working as a nurse and just overall experience, more experience in the healthcare field in general and talking with patients and taking care of patients while also still obtaining the degree, which I thought was super valuable.
Oh, absolutely. I think I had 4 to 5 years of nursing experience before I became a nurse practitioner. And I'm so glad that I had those experience in acute care, ICU care, and then also outpatient, because those experience helped me a lot. I feel like becoming a provider and making decisions on diagnoses and treatment plans and prescriptions, it's a very heavy responsibility. And even with those experience as a new grad, I felt very nervous about taking on those responsibilities. And so I felt, at least with the NP path, you get prepared over a period of time, and also gradually you're introduced to the medical field.
Absolutely. I totally agree with that. I think it's a totally different level of responsibility of taking care of people, being able to prescribe medications, and any experience that you can get is going to contribute to you being more comfortable interacting with patients, recognizing symptoms and diagnoses. And yeah, I was super thankful that I could work as a nurse prior to becoming a NP.
And I think for those who didn't watch the previous episode with Michelle used to be my student. And when I'm watching her talking to patients, she was very good at counseling patients. And of course, her dietitian background really helped her, I think, a lot. But also, one of the biggest, I think, strength as a nurse practitioner for me is our counseling skills. There are a lot of patients of mine go to earn and they come back to me and say, I got these prescriptions, but I didn't take these medicines. I wanted to talk to you first. And not that I just wish that they took medicines, because I want them to feel better sooner, but that just shows how much counseling is important. And if patients are not counseled enough, they don't know what this medication is for, what kind of side effect that they can expect, how to take the medicines. They won't take those medicines even if you prescribe. That's not just enough for them. And I feel like as a nurse, we learn how to communicate with patients, how to ensure they are understanding. So we learn how to teach them at their level, which is individualized. And I feel like that's one of our strengths.
Yeah, absolutely. I agree with that. I think the why is huge, and having patients understand why it's important to take these medications, why it's important to follow these guidelines. And I think nurses are really good at communicating with patients and recognizing when maybe something isn't understood and then providing them with more information. And yeah, I think also in my field of primary care, a lot of it is preventative as well. And so that education and counseling component is huge.
And another thing is nursing really focus on being comprehensive, seeing patient as a whole, not just like looking at the organs or disease, but also like social aspect of where they work, what they do, what they eat, who they live with, their financial situations, and integrate into the treatment plan. If we prescribe medication but patient have no way to get to the pharmacy, it's not going to be effective because she won't be able to take the medicine. Then we sometimes become like a case manager, that we arrange, we look for a pharmacy who delivers medications, or we try to figure out, maybe try to find a cheaper medication that's more affordable for patients and so on. So I feel like with your background, especially having a dietitian background, and that's extremely helpful. I am not really good at nutrition counseling, and I always refer my patients to dietitian. Luckily, we have dietitian on site, but I bet that's really helpful, especially when it comes to chronic disease prevention and stuff like that.
Yeah, absolutely. It's been really great to have that background and be able to continue to share it with patients as I continue into my NP career. So yeah, but I do see a lot of it. It's a holistic approach to caring for patients when it comes to being a provider. It's not only addressing their medical chronic conditions, but also taking into account even their mental health and how that impacts their health, the resources that are available. So it's a very multidimensional role that providers have to play.
Absolutely. And I think sometimes we're questioned, like, so you're, like some patients ask, like, when are you going to medical school? Or what is the difference between physicians and nurse practitioners? And I feel like we both have strength and some weaknesses as well. And I like being a nurse practitioner because our strengths are very clear. Like we're very good at counseling patients, making them feel comfortable, and assessing patients too. I get all the time, you're the only one who noticed this. And I'm like, I just have, with my nursing experience, I just have almost like a sixth sense thing. It's like something is off. So I think that's not just a little weird mystery thing, but it's just, I think, some skills, assessment skills that we built as a nurse over the years. And I felt like we have a strong identity. We're not just mini doctor or mid-level provider who just do less than physicians, but we have a different approach and have strength. I do like that. And then also being a part of is the largest healthcare profession, nursing. So it's pretty cool.
Yes, definitely agree.
I think some people may say some of the cons of choosing NP pathway is you have to go to school longer. That means you have to pay more tuitions. What do you think about that?
Yeah, so in terms of cons, I wouldn't say that it's a con rather than it's a commitment. But yeah, the program that I took was 4 years. It took 4 years to complete, as well as tuition isn't cheap either. And so I think it's important to, take that into consideration when you're exploring which pathway you want to go into. It's, again, taking a look at your pathways holistically. For me, yeah, the NP program, it was rigorous, 4-year commitment, but I think it was definitely worth it in the end. But yeah, definitely something to consider when you're exploring what you want to do.
And like you said, although it takes longer, you have to go to school longer for NP path, but you are able to work as a nurse for you, like after the first year. So there is a way to catch up with the bills and stuff like that. And also, it's not just you making money, but you also experiencing learning and getting paid. Actually, I think it does make sense to take a graduate. I honestly feel like even as a new grad, and I graduated on top of my class, but I still felt very scared to take on the new role of thinking like, oh, what if I make mistake and then I miss something and stuff like that. But I think with having a solid basis as a nurse, that really helped me to build my confidence.
Yes, definitely. The experience helped me as well feel more comfortable interacting with patients.
For those who are considering deciding whether they want to take the NP path or PA path, and I know it depends on the person's situation, but if you can give some advice, what would you say?
I think the biggest piece of advice I can give is to reach out to nurse practitioners or physician's assistants that are already practicing and shadow them. Take time, more than just a day, to follow them and see whether that's what you expected and that's what you want. If you're interested in a specific specialty, then seek out mentors and people that are practicing in that field so that you can get a firsthand look and experience of what it's like to be operating as a provider. But I did that before I decided to go back to school, nurse practitioner school, and I thought it was super valuable.
Good for you. Yes, I totally agree. And like you said in the beginning, we can't really speak for PA because we've never been a PA. So we can't speak for them, and PAs absolutely thrive for a certain specialty. I think ER and orthopedics and stuff like that. So it also depends on, shadowing is probably the fastest way to see if that really fits you.
Absolutely. Yeah.
All right, thank you so much for your time. I appreciate it.
Thanks, Miki.